Good day everyone, Trainer Maximus here. Thank you very much for joining me for this quick fix series. Today we're going to work on the Cossack squats. As always, I thank everyone who supports my channel. Thank you so much everyone. Thank you for your suggestions, comments, watching my videos, your support. Thank you. Also, your super thanks and donations are greatly appreciated. And of course, my support angels. Thank you. Thank you everyone. Now let's have a look at the Cossack squat I keep seeing at the gym. So first, a person sets themselves in this position, or actually with the legs together, dumbbells, no dumbbells, whatever. And they go like this, sideways, 1 and 2. Maybe slightly better, looking straight ahead, trying to keep the heel planted, 1 and 2. And we'll go from there. From the side, it looks kind of interesting. From the front, it looks okay, since you cannot really tell how much the knee is going forward. Now we want to reconsider a couple of things here. First of all, this exercise is not really about bending the knee and straightening the knee. This exercise is about hip mobility. In the first place, we need to bend the hip, flex the hip, and extend the hip. And the knee is going to facilitate the movements, not the other way around. Why? Because if you think that it's about strengthening your quad, it's not really the case. The quad muscles are attached to the legs here through the tendons to the lower leg. So the quad muscles would typically pull the shin bone forward like this, knee into the extension. But once the foot is on the floor, the quads can't pull on the shin bone. So the contraction of the quad muscles will be affecting the upper leg. They will attempt to bring the upper leg around the knee forward. 1. And when it happens, that will incentivize the entire torso to go forward and the knee float forward as well, almost on the toes, making it extremely difficult for you to keep the heel on the floor. And because your heel will be insisting on going over the floor, you might start thinking that something wrong with your ankle mobility. Nothing is wrong with your ankle mobility in general. The exercise needs to be slightly in a different way. So let me first demonstrate the thinking that you are bending the knee and you go sideways. 1, bend the knee. Well, when you think you're bending the knee, it's the hamstrings movement. The hamstrings would ideally want to do this to the shin bone to pull it up, but again, it can't. So the hamstrings will be affecting the pelvis, pulling the pelvis down like this. You see what's going to happen to the knee, right? When I bend it with the hamstrings. 1, the knee is collapsing forward because of the strong activation of the hamstrings muscles, which are attached to the pelvis, to the bottom of the pelvis, pulling on the pelvis as well, since the shin bone can't move. And that collapses the knee forward like this. 1, great. Now you go on the toes, 1, and from here, very strong stretch of the quads already, and you're going to attempt to straighten the knee from this position, which is extremely difficult because the muscle of the quads are overstretched effectively, and you're going to start that activation of the quads from the overstretched position, which will put extreme strain on the knee tendon, leading to potential injuries and inflammations. And even though if you were to be successful with this, you'll be doing this. 1. You see how from here, since the quads are working, the quads are trying to pull the leg around the knee. 1. That will make it virtually impossible for you to keep the spine upright, because the moment the upper leg wants to go forward, the entire spine is sitting, for again unknown reason, on the other side of the upper leg, here with the pelvis. So when your upper leg is going up and forward, the spine will go along, of course, forward. No matter how hard you try to stay upright, you're going to just stay upright but still be in this position. Very difficult, especially when you're doing the Cossack squats with the dumbbells in your hands. So instead, in the hands. So instead, we want to rethink this movement. It's all about the hip flexion. In the first place, the hip is not here. The hip is not bending at the hip bone. The leg is bending here at the true hip. And I made a video of this, Gymnastics hip mechanics. I explained it in great details there with a couple of exercises. Have a look at this. So, but picture for now that the joint of the leg is here by the pocket areas, your Charlie horse place, high school, remember, sweet memories. So you're thinking that on the way down, you're not bending the knee, you are flexing the hip. And the hip is flexed by the hip flexors, your lower back muscles, iliacus, psoas minor, major, etc. They're attached to the spine, one of them, exiting the upper leg here and attached to the upper leg here. So in order to bend the hip flexors are pulling on the legs kind of in one. That's great because you created very good compression in the hip. The pelvis stays in neutral position, giving an opportunity to your spine to stay in the neutral, almost upright position. So now have a look what's going to happen. I'm bending the hip, leg in, leg in, leg in. That's great. So now I'm not completely in this position. My heel is well planted. My knee is not too much forward. Of course, the knee will go forward a little bit, but generally it will not pass the toe line, as the general suggestion goes, right? So by sucking the leg in and picturing that you're bending at the true hip, you're first of all creating the compression here, making sure that the butt is sticking out nicely, not because you arch the lower back, but because you are using the hip flexors here, and the hip flexors grabbing the pelvis and pulling it very tightly against the upper leg. Great. Compressed, spine upright. That's great. There is no need to lean forward. Now, on the way up, you're not thinking I'm straightening the knee. Not at all. You're thinking I'm straightening the hip, the upper leg, again at this area. And for that, we actually don't use the hamstrings because the hamstrings are attached to the shin bone here and to the pelvis here. So in this position, in this particular position, when the knee is bent at 90 degrees, if you over-engage the hamstrings, then the knee will be locked in this angle, making it impossible for you to straighten the hip. So instead you think, okay, I'm relaxing my knee a little bit so that the knee stays loose in order to facilitate the hip extension. And the other muscles get to work. Your glutes in the first place, and not the first place, second place actually. The first place will be given to adductus magnus. That adductus magnus is a huge muscle. It attached here, occupies almost the entire surface of the back of the leg here, and attach itself to the pelvis here. So given the condition, the pelvis is nicely secured by the hip flexors. This guy is tiny bit pre-stretched, adductus magnus, which is great. It's not awfully stretched because your leg is not really close to the torso. It's just tiny bit pre-stretched. That makes that muscle very strong when it's slightly pre-stretched, not really compacted, not having any slack. So any movement from here will be transferred onto the upper leg, which will be taken down, but because there is the shin bone in the way of the upper leg. The way they designed the hips, I don't know, not my fault, but they placed the shin bone here. So when these guys are grabbing the upper leg and pulling it down, all these pulling force is transferred into the stable shin bone, which is perpendicular to the floor, supported by the ankle muscles, and therefore the entire body will go up. And by doing this, you saw, if anything, my knee will be dragged a little bit back because I'm kind of withdrawing the leg into the socket around this portion. The knee goes away from the collapsed position, which makes it extremely easy for the knee to do its job because now it's not overly stressed. It's here, and the whole movement feels very powerful, targeting the right muscles. And at all time, you're trying to think knee relatively loose to minimize the engagement of the quads and the engagement of the hamstrings. Of course, at some point, the quads and the hamstrings are going to get involved, but they will mostly play a role of muscle stabilizers, assistants, and not the main moving force. We don't need them to be the main actors. The main actors here are hip flexors on the way down and hip extensors on the way up. So let's have a look what it would what it would look like if we do that correctly. Standing tall, upper spine upright, lower spine down, good, no crunching, no arching, and you go sideways, leg in, 1, back 2, 1, 3, 2, and 3, 4, 5, leg in, 6, and that's it. That's how you do the Cossack squats, targeting the hip flexion, hip extension, and not the knee flexion, knee extension. That's it, everyone. Now go try at the gym and let me know how it went for you. Thank you very much for your attention. Go enjoy your day. Trainer Maxim with you. Thank you very much.